Big body back again is the most important one, because if you don't change your habits, you can gain weight back. It's totally normal.
Okay, got it now. Thank you.
Our patients' portion sizes are so small. You need to follow a healthy life and also chocolate.
Second video is about to come. Yeehaw! It's arrived and it's starting. Hello guys, welcome. And today it's another session of All About Health. And I'm Lily, and today we have a very special guest, a wonderful, sweet, kind, professional dietitian, Nayat.
Hi everyone! What are you doing?
I'm drinking cola.
No, it's forbidden in this clinic.
It's forbidden.
You cannot?
What about outside?
No. You can just smell.
Can we drink it?
No.
Okay. Bye, cola. Bye.
Forever.
And so, of course, as you already know by the title of that session, the session of health, we're going to have another discussion with one of our dietitians, and we're just gonna have all, the information that we all need and also our patient need. And so let's start with the first question. So Nayat, what approximately is, the weight loss after bariatric surgery?
We have goals for every month. So our first month goal is 10% of your starting weight. Then it should slow down, because you cannot lose 10% every month. It's not possible. So after that, you're gonna lose 10% more, but in 2 months. So the total loss will be 20% in 3 months.
Yeah.
And then it's gonna be 30% in 6 months.
Okay.
So if you are 100 kg, you're gonna lose 30 kg in 6 months.
Okay.
Okay?
Okay.
And then at the end of the year, our goal is 35-40% of your starting weight, which is
Okay.
the ideal weight for you.
Okay. So it doesn't change from patient to patient, right?
No, because the percentages are same, because we're calculating that according to your starting weight.
Okay.
Okay, if you are heavier, you're gonna lose faster and big amounts.
Okay.
If you are not heavy that much.
Okay, perfect. Thank you. So now we go to our second question, which is about, of course, we do know that our patients, they have to follow some rules after a weight loss treatment, which is okay, a healthy way of living, new life. It's very important. We get it. But as a dietitian, what can you say about the 3 most important rules that a patient must follow, like strictly after a weight loss treatment?
Okay, so the first one is the most important one, solid and liquid separation. You should follow this rule for the rest of your life. Otherwise, you can have weight gain problems, or your stomach can get bigger. So you should follow this.
Yeah.
You don't have any exception.
Yeah.
The second one, you should stay away from fizzy drinks, because they are stretching your stomach too. So I don't recommend you to drink sparkling water, Sprite, cola, that kind of fizzy drinks.
Yeah.
And the third one, stay away from junk food, because if you don't change your habits, you can gain weight back and you can get that big body back again.
Yeah, okay. Thank you.
You're welcome.
And now we go to our third question, so which is about actually the diet and the weight loss process. So when a patient switches from liquid to pure diet in particular, sometimes some patient can actually, have some slowdown with their weight loss.
Yes.
So would you say it's something that can actually happen? Like, is it normal, or is it just completely different?
It's totally normal.
Okay.
It's happening to every patient, because when you start to do a diet, even if you don't have the surgery, at the beginning you're starting losing from the body liquid.
True.
So our patients are having the same thing. So they are starting with the body liquid loss. Okay, so they're not starting with the fat burn. When they stop the liquid diet and when they switch to pure diet, their fat burn starting. Okay, so that's why they are gaining the liquid back, because their body need that liquid. So when body gain the liquid back and start the fat burn, they are balancing each other, and they're thinking they're not losing weight.
Okay. So it's totally normal then.
Yes, it's happening, but patients are feeling that they're not losing weight, but the body is losing from the fat. But during that process, patients are feeling they're not losing weight, but they're losing from the fat, but they're not just seeing on the scale.
Okay. Got it now. Thank you. So now we go to our fourth question, which is actually about, right, during the period of like having protein powders. So some patients actually wonder if it's possible for them to change if they don't want or don't like the protein powders that we give them here. So can they change with other foods after bariatric surgery?
Okay, so first of all, when they don't like their protein powder, I'm offering them to change the powder with another brand.
Okay.
Because they need that powder. They cannot get that much protein with food.
Okay.
Because they're just drinking liquids like
Yeah.
dairy drinks or chicken broth. So it's not enough for the healing. So we will offer a protein powder option first, a different brand. Then if they don't like that, we need to find protein enriched dairy drinks.
Okay.
Okay, like ready shakes, but we need to check the ingredients and the nutrient chart together with the patient.
Okay. So now we have another question, which is like about the after surgery time, right? Patients, when they have the surgery, they have to follow a specific like medication period of time. So some of our patients, or let's say most of our patients, they do wonder after a bariatric surgery, should I continue for the rest of my life taking those medications like vitamins, minerals, stuff like that? So is it like an obligation for the rest of their lives?
So not for all of them.
Okay.
The ones who had gastric sleeve, they don't have any problem with the absorption because we are just restricting the portion sizes. So they will get enough vitamins from the food. But the ones who are having a surgery like bypass, which we are changing the absorption system with cutting the intestines, they may need using multivitamins more than the sleep patients.
Okay.
But for both of them, my recommendation is having blood checks and detect which vitamin is absent and take that one only.
Okay.
So I don't recommend multivitamins for the rest of our life for our patients.
Okay, okay, got it. Okay, so my question now for you as a dietitian is about the nutrition part, right? So after bariatric surgery, would you say this way is better for a patient to eat 3 meals a day, or a patient should eat regularly and then have like snack?
Our patients' portion sizes are so small, so they can get hungry much more regular than a normal person.
Okay.
So that's why we recommend them to have regular meals to keep their metabolism up.
Okay.
Otherwise, if they stay longer periods on fasting, their metabolism can slow down and it can affect the weight loss. So we recommend them to have 3 meals a day, and between the meals, they should take snacks.
Okay, so that means having more than like 3 meals kind in some ways.
Yes,
Okay,
just
got
like
you.
that.
Got you. Perfect. Now, the other question for you is about meals, right? So after bariatric surgery, how would you describe the types of food that a patient must avoid after that?
So we can divide our avoiding foods into 2 groups. The ones you should avoid for the first 3 months after the surgery,
Yeah.
such as acidic fruits, acidic vegetables, onion, garlic, etc.
Yeah.
And after the 3 months, you need to follow a healthy life. That's why you should stay away fried foods, high caloric foods like bread, rice, pasta, potato, like chips, packaged foods. So we don't recommend these kind of foods after the surgery if you don't want to gain weight. And also chocolate.
Okay. So, okay, perfect. We've had pretty much many information, so far. And thank you for, giving us all these information, because I think and I believe they'll be very, very, very helpful for a patient and patients who would like to, have just more knowledge about all that. And of course, guys, there is a second part, and please stay tuned because the second video is about to come. So see you soon.
Bye.